This patient primarily suffers from chronic rhinitis. For chronic rhinitis, we can choose moxibustion as a treatment method, as it is primarily used for long-term health care. We can perform moxibustion at home, and family members can also assist us. The first acupoint is the Dazui acupoint, located at the top of the head when the head is normally lowered. If you can't find the precise location, it's fine. Just moxibustion in that area. Since we can't locate on the skin during moxibustion, we need to rotate it. Alright, this is the first acupoint. The second acupoint is the Fengqi acupoint, located at the two depressions in the area of the lower edge of the occipital bone behind the ears, also at the end of the hairline. When performing moxibustion on the Fengqi acupoint, especially for women with long hair, it is recommended to tie up the hair to prevent burning. Each acupoint is generally treated with moxibustion for 2 to 3 minutes. Then you can come back and moxibustion again. The other side is the same. After moxibustion is done, it is recommended not to wash your hair on the same day to prevent external evils from invading again. The third acupoint is the Fangfu acupoint. Located in the depression above the cervical spine, following the spine to the top. Moxibustion at this location is a form of home health care for chronic rhinitis. There is also an acupoint directly opposite the nasal cavity, the Changjian acupoint, located directly above the midline of the head. If you have allergic rhinitis or rhinitis leading to constant nasal discharge, you can perform moxibustion on this acupoint. This method relieves symptoms quickly and complies with the Chinese medical method of treating the disease after it occurs. In addition to the above acupoints, the Yintang acupoint on the front of the face can also be moxibustioned. If you can't moxibustion the acupoints on the back at home, you can moxibustion the Yintang acupoint every 2 days. This method can quickly relieve symptoms such as rhinitis, nasal congestion, colds, and runny nose. But keep in mind that our skin is relatively thin. Everyone can decide the time and temperature according to their own situation. Usually 3 to 5 minutes of moxibustion is enough. Then we can gradually expand the range of facial moxibustion. After moxibustion is done, you can press the nasal passage, which is the lower end of the nasal bone, with your thumb and index finger. Release after pinching 5 times. Let the patient breathe. After moxibustion, nasal discharge may occur, so after massaging the nasal passage, you can quickly expel the original nasal congestion. It is suggested that normally you can do 300 times.